Klaron Suspension, topical is a medication used to treat acne by stopping the growth of certain bacteria on the skin that can worsen acne. It belongs to a class of drugs known as sulfa antibiotics. The recommended daily dosage and optimal timing for using Klaron Suspension, topical is usually prescribed by a healthcare professional and may vary depending on the severity of the acne. It is important to follow the instructions provided by your doctor for the best results. This medication should only be used on the skin. Before each use, make sure to shake the container well. Use clean hands to apply a thin film of the lotion to the areas of skin with acne, as directed by your doctor, usually twice daily. After each use, be sure to wash your hands with soap and water. Make sure to avoid getting this medication in your eyes, nose, or mouth. If you do accidentally get the medication into these areas, rinse with plenty of water. Using this medication regularly will help you get the most benefit from it. It's important not to use larger amounts, use it more often, or use it for a longer time than prescribed. Using it in these ways will not improve your condition any faster and may increase your risk of side effects. If you find that your acne is not improving after a few weeks, be sure to inform your doctor. Also, if your acne worsens, or if you develop a rash or other serious side effects, stop using this medication and contact your doctor right away. For more information on potential side effects, check the side effects section. When using Klaron Suspension, topical, you may experience skin redness, irritation, stinging, or burning at the application site. These effects should lessen over time as your body adjusts to the medication. If they persist or worsen, stop using the medication and consult your doctor or pharmacist. It's important to note that this medication has been prescribed to you because the benefit is greater than the risk of side effects. Most people using this medication do not experience serious side effects. In rare cases, sodium sulfacetamide products applied to the skin may be absorbed and cause serious side effects. If you experience aching or swollen joints, a rash on your nose and cheeks, signs of infection, signs of anemia, unusual bleeding or bruising, signs of liver problems, or mouth sores, stop using the product and contact your doctor immediately. While a serious allergic reaction to this drug is rare, seek medical help right away if you notice symptoms such as rash, itching or swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so if you notice any other effects, be sure to contact your doctor or pharmacist. If you're in the US, call your doctor for medical advice about side effects, or report them to the FDA. In Canada, you can report side effects to Health Canada. Before using Klaron Suspension, topical, make sure to inform your doctor if you are allergic to it or to sulfa antibiotics. Also, let your doctor know about any other allergies you may have. This medication may contain inactive ingredients that can cause allergic reactions, so it's important to discuss this with your pharmacist. Before using Klaron Suspension, topical, inform your doctor about your medical history. If there are any areas of skin near where the product will be applied that are cut, scraped, burned, or infected, be sure to let your doctor know. Injured skin may absorb more of the product, increasing the chance of serious side effects. If you are planning to have surgery, inform your doctor or dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. During pregnancy, Klaron Suspension, topical should only be used when clearly needed. It is unknown if this drug passes into breast milk, so be sure to consult your doctor before breastfeeding. When using Klaron Suspension, it's important to be aware of potential drug interactions. These interactions can affect how well your medications work and may increase your risk of experiencing serious side effects. It's important to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share this list with your doctor and pharmacist. One specific product to be aware of is skin products containing silver, as they may interact with Klaron Suspension. It's crucial to always consult with your doctor before starting, stopping, or changing the dosage of any medicines. If this medication is accidentally swallowed, it could be harmful. In case of an overdose with serious symptoms like passing out or difficulty breathing, it's essential to seek immediate medical attention by calling 911 or a poison control center. In the U.S., residents can contact their local poison control center at 1-800-222-1222, while Canadian residents can reach out to a provincial poison control center. Remember to always use Klaron Suspension, topical as directed by your doctor. It is important to apply a thin layer of the medication to the affected areas of the skin, usually twice a day or as directed by your doctor. It is best to apply this medication at the same times each day to help you remember. Do not use more of this medication than prescribed or apply it more often than directed. This will not improve your condition any faster and may increase the risk of side effects. If you forget to use Klaron Suspension, topical, use it as soon as you remember. If it's almost time for your next dose, skip the missed dose and continue with your regular schedule. Do not use extra Klaron Suspension to make up for the missed dose. It is important to store Klaron Suspension, topical at room temperature and keep it away from children and pets. Do not flush this medication down the toilet or pour it into a drain unless specifically instructed to do so. When this product is expired or no longer needed, make sure to properly discard it. You can consult your pharmacist or local waste disposal company for guidance on how to do so. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.